Hey friends, this is Dr. Kriti Pathrikar, Samarth Hospital and IVF Centers. I work as a chief embryologist. We have just finished an ICSI. Do you think this is enough for a good embryo quality? Let's discuss today about what affects the lab conditions and what are the good practices for giving you good quality embryos. So first of all, we talk about the equipments which help us for maintenance of good quality air, which are the air handling unit, the positive pressure maintenance units, and the filters which are used in the lab, the lab guards and the laminar flows. The second most important machine which helps us in maintenance of good quality embryo are the incubators. Incubators are the machine which mimic the uterine environment outside a human body for the incubation of embryos till day 5. For maintenance of good lab and the lab practices which are supposed to be done for the maintenance of good environment in incubator and lab are, you should keep a log of the times that the incubator is getting opened and closed, the drop in the CO2 and the temperature which is being measured, and you have to minimize the drop so that the embryos will get an ambient environment for the growth. The second factor which you have to rule out is the timely maintenance of your equipment, timely calibration of your equipment, so that to see whether whatever is being shown on the monitor is the environment that the embryo is getting inside the incubator. The temperature is being maintained, the CO2 percentage is getting maintained, so that the pH balance is being maintained for the embryo growth. The third important factor which plays a role in good laboratory practice are the work of the embryologist. He or she who is performing the embryological work should have enough experience to rule out the subjective differences that come in handling the oocyte, for performing the ICSI, for preparation of sperm semen sample, and for subsequent incubation, grading the embryos, and for selection of the embryos for implantation and transport. The fourth important factor which plays a major role for embryo formation in a lab are the disposable quality, the media quality, and the subsequent incubation procedures which are used for incubating the embryos and the gametes in a lab. So the least that you can do in your lab for assuring a good embryo formation are the type of equipments that you are using, the brands of equipments that you are using, the type of air handling units that you are using for the air quality, or for maintaining the viability of gametes in your lab, the medias and the disposable, and very important point, a good person, experienced person to handle your gametes. To know more about information on infertility, please visit our channel Samarth IVF. Thank you.